Welcome to the Bioscan Hub channel. And hey, if you like what we're doing here, don't forget to subscribe to support us. So today, we're diving into one of the absolute cornerstones of the clinical lab, urinalysis. You know, it might seem like a pretty basic test, but a urine sample, it's like a liquid diary. It's a biological story that's written by the body. And our job as future lab professionals is to learn how to read it.
All right, here's how we're going to break it down. First, we'll talk about why we call the sample a story. Then we'll get into the clues we can find just by looking, both with our eyes and a microscope. After that, we're going to decode some powerful hormonal signals, then switch gears to investigate drug use. And finally, we'll wrap up with what is maybe the most important part, your critical role as the analyst.
So, let's start with this idea of a liquid biopsy. I love that term. Because that's really what it is. It's a totally non-invasive way to get an incredibly detailed snapshot of a patient's health, what's going on with their metabolism, their whole system. Every single thing in there, from cells to chemicals, well, that's a new chapter in the patient's story.
Okay, before we even think about reaching for the chemical reagents or firing up the analyzers, our investigation starts with the most basic tools we have, our own eyes, and of course, a microscope. You'd be amazed at how these first observations can give us immediate, valuable clues that point us in the right direction.
You know, sometimes just a little bit of basic physics can give us our first big hint. It really all comes down to density. So think about it. If you see stuff floating right on the surface, it's probably light, fluffy mucus. If it's kind of suspended there in the middle, we're likely looking at epithelial cells. But, and this is a big one, if it sinks right to the bottom, that's heavy. That suggests pus, which is packed with white blood cells, and that's a huge red flag for a possible infection.
Now, sometimes we find things that aren't technically from the urinary tract, but they are absolutely clinically significant. So that word contaminant can be a little bit misleading. It doesn't mean we just ignore it. Not at all. Finding yeast, for instance, could point to moniliasis, a yeast infection. Seeing parasites often tells us about fecal or vaginal contamination, which is crucial context. And spermatozoa? That could be from recent sexual intercourse, or it could indicate prostatic disease. Every single one of these findings is important and has to be reported.
All right, let's shift gears. We're moving from what we can physically see to what we can measure chemically. And urine is just an amazing medium for detecting hormones. These are the body's powerful chemical messengers, and by measuring them, we can uncover everything from a new pregnancy to the possibility of tumors.
And of course, the most famous of these is human chorionic gonadotropin, or HCG. This is the pregnancy hormone. It's produced by the placenta almost right after conception, and its presence in urine is what makes those pregnancy tests turn positive. Now, for you as lab students, here's the key detail. HCG has two parts, an alpha and a beta subunit. It's that beta subunit that we target because it gives us the most sensitive, most specific test for an early pregnancy. Remember that.
Look, you can have the best equipment in the world, but garbage in, garbage out, right? The accuracy of our test depends completely on the quality of that sample, so proper collection is absolutely critical. First, you always want that first morning urine if you can get it. That's when HCG is at its peak concentration. If you can't, random sample is okay, but you have to check that its specific gravity is over 1.005 to make sure it's not too dilute. And finally, if a specimen is grossly bloody, you got to reject it. It can totally mess with the assay.
So a positive HCG test, it almost always means pregnancy. But, and this is so important, we have to know the other possibilities. Remember, HCG is made by placental tissue. That means a positive result can also be a marker for some really serious pathologies involving similar tissue, for example, a choriocarcinoma, which is a very aggressive cancer, or a hydatidiform mole, which is an abnormal pregnancy. And, believe it or not, even some testicular tumors can produce HCG, so it's a pregnancy marker, for sure, but it's also a tumor marker.
As analysts, we have to be detectives, right? We always have to think about what could be throwing off our results. You can get a false negative HCG if the urine is just too dilute, or if the test was done way too early in the pregnancy. But on the flip side, you can get false positives. Things like proteinuria, that's too much protein in the urine, or hematuria, blood in the urine, can cause it. Even certain drugs like methadone can interfere. This is exactly why we never just look at a number. We always look at the patient's whole clinical picture.
Beyond HCG, urine is also a fantastic window into a person's estrogen levels. But it's really important to know which estrogen we're talking about. We measure estradiol, or E2, when we're looking at things like fertility issues or possible estrogen-producing tumors. But once someone's pregnant, our focus shifts completely to estriol, or E3. E3 gives us vital information about the health and integrity of that fetal placental unit.
Just look at this chart. The rise of estriol during pregnancy is absolutely dramatic. In that first trimester, we're seeing levels around 800 micrograms per 24 hours. Okay. Then by the second, they explode to 12,000. And by the third trimester, a massive 50,000 micrograms. It's just incredible. This exponential increase is the classic sign of a healthy, progressing pregnancy.
So if that huge rise in E3 is a really good sign, well, a decrease is a major warning. Consistently low or falling E3 levels can point to some serious problems, like the placenta not working correctly. And here's a critical value. An abrupt drop of 40% or more on consecutive days is a huge red flag for potential fetal distress. Decreased levels are also associated with conditions like Down syndrome, which makes tracking E3 a key tool for monitoring high-risk pregnancies.
All right, so we've talked about hormones that create and sustain life. Now we have to turn to substances that can harm it. This brings us to another huge application of urinalysis, toxicology. When we're screening for drugs of abuse or just monitoring therapeutic drugs, urine is almost always the sample of choice, and there are some really good reasons for that.
So why urine instead of blood? Let's break it down. First, it's non-invasive, it's easy to collect. Simple enough. Second, drugs and their byproducts, their metabolites, are often way more concentrated in urine, which just makes them easier to find. But here's the biggest advantage: the longer detection window. Blood shows you what's in the system right now, current impairment. Urine, on the other hand, can show you drug use from days, sometimes even weeks ago. The one big exception is alcohol. For that, blood is still the gold standard for measuring current intoxication.
So where do we actually use toxicology screening? Well, the applications are all over the place. In a hospital, you might use it to confirm a diagnosis, or to figure out if a patient in a coma is there because of drugs or something else. But it's also used constantly in occupational health for workplace and pre-employment screening. And of course, in the world of sports to test athletes for performance-enhancing drugs. And that brings us to our final and honestly probably the most important section of all. We've talked about the science, the methods, the procedures, but none of that means anything without the integrity and the diligence of you, the clinical analyst. Your role goes so much further than the lab bench. It comes with a really profound professional responsibility. I want you to just let that sink in for a second. The results we put out can have massive, life-altering psychological, social, economic, and legal consequences for a person. A mismanaged or an incorrect result isn't just a number on a piece of paper. It can cost someone their job, their family, their freedom, their health. This really underscores the immense weight of the work that we do every single day. This leads us to a principle that is absolutely non-negotiable, especially in toxicology. Every single positive screening result must be confirmed. And I don't mean just rerunning the same test. It has to be confirmed by a second, equally sensitive method that works on a completely different chemical principle. This is our safeguard. This is the bedrock of legally and ethically sound laboratory practice, period. And so that leaves us with one final question to think about as you continue on your journey to becoming a professional in this field. We know accuracy is everything, but beyond that, what do you think is the single most important quality of a clinical analyst? Is it diligence? Is it integrity? Critical thinking? That's something for you to reflect on as you prepare to take on this absolutely vital role in patient care.